Zatulalua for keeping us updated on the latest details. And we want to stay with this for now and talk about, of course, the death of the former Nigerian president, which happened whilst undergoing treatment abroad. Now, it's shed the spotlight on the state of healthcare in Nigeria. Now, earlier I spoke to Dr. Nikea Nwachukwu, who's a public health advocate on this, and I began by asking him to paint a picture of the state of the healthcare sector. This is what he told me.
I'm someone who spent 30 years abroad, and in the last 8 I've been strictly here. And in that time, I have seen huge challenges, regardless of the government in power. At the moment, we have a situation where things are particularly bad because there is very little funding, or not enough funding, to meet especially some of the primary care needs, especially in suburbia. Additionally, when you look at secondary care and tertiary care, a lot of the specialists have had to leave the country because of financial constraints.
I'm sure in medical circles, there was also a discussion around what needs to be done in Nigeria to ensure that anyone within the country who needs medical care can get it there. What sort of discussions are you hearing around this?
If we look at every sector, we can talk about even the man on the street. I mean, there is more malnutrition now than previously, and you have to eat to even stay healthy. We have underfunding in terms of every level of healthcare. As a matter of fact, we are, for the first time, reaching 5% of budget, of GDP, of our budget for healthcare. The Abuja Declaration about 23 years ago was recommending 15%. Now, that is quite an ambitious goal, although one can say this is the first time any government has gone up to 5%. It's been usually in 3s and 4%. We have an issue around retention, and government needs to work on salaries of healthcare workers, especially when some of those in places of politics, and especially the legislature, sometimes their remunerations are plastered all over the news, and for what one man gets in remuneration, you could treat an entire suburb. We also need the government to potentially look at ways of working with the private sector, who account for 70% of the healthcare provisions. And that's, especially around COVID, there was some element of that, and that's not happening. So there's a lot of, it's multifactorial. And I think we have a Minister of Health who I actually think has been saying all the right things and so far doing all the right things, but it's not trickling down fast enough.
Let's now switch gears.